Hi, my name is Dr. David Scratchley. I'm a psychologist in Seattle, Washington who works in the area of treating people who are addicted, both adolescents and adults. Today I'm going to talk with you about a mental health condition related to addiction. That's attention deficit disorder. And we know from our research that when people are diagnosed with attention deficit disorder, that the likelihood of using drugs is much higher than if they are not diagnosed this way. Thus, I'd like to be able to discuss it in the context of how it relates to drug use and drug abuse. Now, there's a presentation associated with this particular discussion today. There's a study guide, and I encourage you to go to my website and for no cost download it at www.drugseminars.net. It's called ADHD, ADD, and Drug Abuse, and it specifically covers areas of attention deficit disorder and drug use. Now, as we get into it today, the first thing I'd like to do is show you a slide of the brain on a medication, which is a stimulant medication called Adderall. In this particular case, you can see from these brain scans that there's a great deal of increase when people have used a drug like Adderall, which is essentially a form of amphetamine, and there are other forms of stimulants that are used to treat attention deficit disorder. For example, Ritalin, which is methylphenidate, is also something that people have used in the past, and Xylert. All of these are stimulants that are used or have been at least described as being useful for the treatment of attention deficit disorder. And of course, because these are stimulants, these may actually be used without a prescription, and people do trade and use these particular drugs, sometimes with very dire consequences. Now, when we look at the whole condition of attention deficit disorder, what we discover is that the stimulant medications given for ADD, which is attention deficit disorder without hyperactivity, or ADHD with hyperactivity, are also used for a few other conditions like narcoleptic conditions or head injury. And sometimes, but I have seen that this is a decreasing trend. People have even given these drugs for obesity, or in some cases for depression. And what we need to be aware of is, because many of these drugs are amphetamines or stimulants like that, they may be actually very similar to amphetamine or cocaine. Now, when we started to look at this, we discovered that when people have the diagnosis of attention deficit disorder, what we now know is that using stimulant medications does not lead to an increase in drug use in people who have had stimulant medications for the treatment of ADD or ADHD. But what's sad about this is we know that people with this diagnosis, ADD or ADHD, are many times more likely to use drugs. In fact, average across America for people who become addicted is about 10% of the population. But for people with the condition of ADD or ADHD, it's between 22 and 45%, depending on what study you look at, will actually have problems with drugs. So being diagnosed with this condition does, unfortunately, place you at risk for a later episode of drug use, or even an episode of drug use while you're an adolescent. And giving the stimulant medications has not been found to increase the likelihood you'll use the drugs. But sadly, here's the kicker to that: it doesn't decrease the likelihood of using drugs either. So it really doesn't have any impact of stimulant medication on the issue of drug use at this point in the research. We can say there's no indication it either increases the likelihood of drug use or decreases the likelihood of drug use. It's about the same for people who didn't receive stimulants for their ADHD or did receive stimulants for their ADHD. Now, the other thing is that we have to ask the question, why is it that people with this diagnosis become addicted? And what we've discovered is that there's a great deal of correlation, a high inheritability for ADHD and ADD, that if a child, for example, displays ADHD, it's about a 70% likelihood one of his closer relatives will also have the condition of ADHD. And therefore, it is a very frequently inherited condition. And many of the genes we think are inherited to give ADHD are also the same genes that may be at risk in a person who later becomes addicted. So there's some overlap there. It's not coincidence. So when people get this particular diagnosis of ADHD, typically speaking, there are three qualities that are used to make this diagnosis. Inattention, where the person has difficulty focusing on details, keeping attention on tasks, doesn't follow instructions or directions, has trouble categorizing or organizing activity, doesn't like to do things that take a lot of mental effort. These are the characteristics of inattention. That's one of the sets of criteria that has to be met for a diagnosis of attentional deficit disorder. Likewise, if a child is qualified as having ADHD, they will display hyperactivity. Now, not all people with attention deficit disorders display hyperactivity. Some have ADD, where they have difficulties with attention span, but don't have the hyperactivity. But if they do have the hyperactivity, people would describe that person as being motorized, as talking excessively on the go, driven by a motor, sort of always in movement, always fidgeting, getting up from their seat when remaining in the seat is expected. These are the qualities that go with the hyperactivity. Likewise, they may be impulsive. They may blurt out answers or have trouble waiting for their turn. They may interrupt other people. These are all ADD, ADHD type qualities. So when people have this condition, again, although people do try to work with it from a cognitive standpoint or a therapy standpoint, talking to the person, more frequently than not, they end up being prescribed some type of medication, and more frequently than not, that is some type of stimulant. And of course, we're always worried about the physical effects if people take too much, which could be blood pressure, changes or brain damage or anorexia. And if they become toxic, they're too attentive, they're repeating things in sort of a rigid manner, they're paranoid how they think, or they're moving in an unusual manner. Obviously, if you know a child who's receiving a stimulant of some sort and they're displaying these things, it is a cause for concern, and that child needs to go very quickly to the doctor or the emergency room. Now, I'd like to say that as we get ready to close this today, I would like to invite you to feel free to go to my website, www.drugseminars.net, to download the slides used in this video at no cost to you today, and also hopefully to find other information you might find useful if you're concerned about drug abuse in your child or your teenager. And please feel free to contact me if I can be of assistance at seattleclinical@gmail.com.